Hello everyone. My name is Professor Ramneek Aluwalia. I am the CEO of Higher Health. This is an agency involved with student health and student well-being across all our universities, our TVET colleges, our CET colleges, including private higher education, work-based learning centers, and many systems and institutions within our post-school education and training system. First of all, let me congratulate you for being where you are today, to be in this post-school education and training system. You worked very hard to be where you are today, and we are extremely proud of you. Now, student health and student well-being is at the heart of every student's ability to progress through their course of study and complete tertiary education, not only for your own benefit, but to benefit your families, your community, and the country. You are the economy that we are waiting for the skills to be developed in. You are the hope of the mother, your guardian, or a parent who has been waiting for you to be in the tertiary system and get those skills to build our nation and build your own family and bring them to the success that you and your family have dreamt to be in. My first slide will reinstate the state of youth epidemics in South Africa, why you are vulnerable and why these epidemics are around you. Very importantly, I spoke about the HIV and TB epidemic. The HIV-TB epidemic is a very top cause of death in the 15 to 24 age group. And HIV ranks quite high in our mortality rates across the youth, across our country. And we need to inform you that we need to be following safer sexual practices and prevention, as I will also offer you services around the HIV and TB pandemic. The unplanned pregnancies is very important, critical, and a huge pandemic. And a lot of young girls drop out from our system because they become pregnant while studying and are forced to drop out because they cannot complete their studies due to the complications of pregnancy that comes along with it. And sometimes youth pregnancies are very challenging in terms of maternal health and the challenges that the whole teenage and unplanned pregnancies come along with it. Gender-based violence, rape, sexual violence, domestic violence, partner violence is all prevalent in the post-school system, in our communities, and across our country. One has to take care of it. One has to look after each other. We have to have a social compact to ensure that we are safe and we protect each other and we bring justice to who is the perpetrator and who do not follow the law towards ensuring the safety of other human beings through this criminal act called sexual and gender-based violence. And we have programs and systems that will help you to fight gender-based violence across our system. Mental health, as I clearly said, suicide, anxiety, depression, stresses remain around you. And you need to be empowered towards all the programs that exist around you to fight mental health. Drugs and alcohol. Sometimes as high as 60% of our students abuse drugs and alcohol every month in our campuses. 65% of gender-based violence in South Africa is preceded by drugs and alcohol, as per the WHO or World Health Organization. I really ask you for responsible drinking. I really ask you for ensuring that we fight the abuse of drugs and alcohol, the addiction of drugs and alcohol, that this can really ruin your career and the beautiful future you have come with. I also want to remind you of other non-communicable diseases that are grappling our young people. Obesity, blood pressure, sugar, diabetes, cancers, have started coming up very early stages in the young people and predominantly due to our lifestyles. And I ask you to look after yourself. My next slides will focus on COVID. It's very important We are in the middle of a massive pandemic called coronavirus. Science has clearly shown us that the pandemic of coronavirus is bound to stay with us for a few more years or many years. It has formulated from an animal to a human transmission, and from human to now human transmission. And when virus takes a human to human transmission, which means that virus is finding comfort into human bodies to survive. And it will keep trying to mutate, keep trying to evolve, to keep surviving. And our war is against a small little organism that we can't see, that has challenges towards even causing death, even causing morbidity, even causing severe challenges both to the economic sense as well as a human body in responding to such a disease. How it spreads? It spreads through aerosols. Evidence clearly shows that small droplets sizes that remain airborne are not possible, but realities of the transmission of this virus from one human to the other. It's a respiratory disease. Droplets. When I talk with you, I have something which is invisible, the form of droplets or micro droplets that go as much as 2 meters. Even while I'm talking to you, it can spread as far as possible. And that is where the virus can move from one body to another human body. Sometimes larger droplets fall on nearby surfaces and objects. So while I'm talking to you, it can fall on my hand. When I rub my face, it can touch my hand. And if I shake hands with you, it can move, the droplets can move from one hand to the other hand. And once you take that hand to your nose or mouth, it can move into you. And that's the easiest way of explaining the transmission of the virus. And it's very important you understand how this virus spreads. Importantly, how does this virus present? Definitely, this virus is mild in most of the cases. 80% of the cases, it remains asymptomatic or even remains mild. Predominantly at your age, as young people, it will be very asymptomatic or mildly symptomatic. But sometimes you do not know that you are living with comorbidities. Sometimes you do not know what your genetics and your human body is in the formulation that how this virus perceives into you. And sometimes young people also die because of this pandemic. So it's not that it remains, majority it remains mild and moderate or asymptomatic, but it can cause severe disease to anyone. Equally, we are all susceptible to this virus. No human body has antibodies or an immune response to this virus, whether we are old or we are young. So only science has shown that children below the age of 12 have some kind of an immune response, a better response to this virus. So young people are equally vulnerable to the virus as other people. And young people can actually be the carriers of this virus because you remain mildly symptomatic or asymptomatic. You can actually carry this virus to the elderly or to your other friends or other peers who probably are living with comorbidities or living with or are highly vulnerable to severe disease and even death. So you have to be extremely careful. How does this virus present? The virus presents with the most common symptom is fever. So anytime you have fever, you can come with cough. And a very important symptom is shortness of breath. We have seen taste or loss of taste or smell as another important symptom around. Many other symptoms are still prevalent, like headache, myalgia, which is pain, body aches, sore throat, among others. 5% of the population have also shown symptoms of the gastrointestinal system, symptoms like diarrhea, vomiting, and they are also prevalent in the system, in the symptoms. So how do you prevent coronavirus? You prevent by washing your hands. Wash your hands with ordinary soap and water or alcohol hand wash, which is 70%. Cleaning of hand is the way to get rid of this infection. This infection actually dies with simple cleaning. But the problem is if we don't clean and we take this hand close to our nose and mouth, it can easily transmit the virus from our hands. physical distance. If we are maintaining 1.5 to 2 meter, safer 2 meter physical distance, and wearing a face mask, which is another way of preventing the virus, we are not allowing the droplets to reach the other individual. And that is how we prevent in getting the virus, in spreading the virus. Do not touch as far as possible your eyes, mouth and nose, because these are the entries of this virus into our human body. So this hand, if we wash it and we try not to touch our important portal of entries, we can prevent this virus. And when we cough in the elbow, so that when we cough, we force the droplets far more than the 2 meter physical distance. And we need to be looking after people. And if we do this, we prevent from the virus to spread. Importantly, when you have surfaces around you, you're living in residences, you're living in your home, you also need to ensure, or you're in your classroom, in your bench, as much as they will always be sanitized, disinfected or cleaned, it's your duty that you take a little bit of sanitizer and take time to clean the surface around you. Even a dilute bleach can kill the virus. There's no need for deep cleaning. And there is no terminology called deep cleaning. And please do not fog, fumigate or pass through any tunnels. Remember, there is no virus after 1 week. All the virus can survive in your soft tissues is from 6 to 12 hours, and sometimes on hardish tissues or hard surfaces for even as long as a week. The 6 C's. If we have to fight COVID, we have to fight it with 6 C's. And what are those 6 C's? We have to avoid crowded places. We have to make sure we are well distanced in closed spaces. We have to ensure that closed spaces are not crowded. And we have to make sure that close contact settings are in place. Exactly the surface and yourself. The other C is care, compassion and community. We are once during the course of the year, most of you will be getting vaccinated. You should get vaccinated. We have to look after each other because vaccination like smallpox, vaccination like polio has eradicated viruses out of our human system. It's one of the best way to do it. And once you are in the queue and once the government brings vaccination close to you, you should opt it. And this is another way of preventing to spread the virus. Isolate, quarantine yourself if you have any symptoms whenever. Care of your elderly, care of your peers. You have to sign a social compact with me, with your vice chancellors, with your students, with your student leadership, and with your academics in order to ensure that we all protect each other and including your families. Let me go further into giving you more programs that you can enroll yourself to fight the real other epidemics that are existent in our communities and among young people, as I spoke to you. Epidemics, which are in my next slide. If you look at this slide, these are all integrated pandemics. HIV, TB, STIs, sexual reproductive health, gender-based violence, mental health, drugs and alcohol, and COVID, I've already spoken about. But I also want to inform you that we have disabled students around us, and they are highly vulnerable to HIV and AIDS pandemic, highly vulnerable to mental health, extremely vulnerable to gender-based violence. And it's our responsibility to look after them and to ensure that we understand what disability is. Sometimes as high as 17% of our population is disabled in one or the other way. So physical disability is not the only disability. Disability comes in many forms. Similarly, key populations. We are all humans and we need to respect each other. We have to respect lesbians. We have to respect gay people. We have to respect bisexual, transgender, intersexual. So we have to respect every human when it comes to human rights. And we have to fight COVID. And if you see in this slide, The HIV pandemic is interrelated to gender-based violence pandemic. Drugs and alcohol is directly proportional to mental health as well as gender-based violence and unplanned pregnancies. So looking after your health collectively is what this slide is trying to explain to you. What is in excess with you? In excess with you is our programs. I'm asking you, join the peer education program. I'm calling on the first years to become the student volunteers, become the peer educators. Just around you, there's a massive peer-to-peer program. There is extramural classes in the form of dialogues in your residences, in your classrooms, that are speaking to you on classes on HIV, classes on gender-based violence, classes on mental health, classes on sexual reproductive health. Join them. And not only join them to attend, but join them as a trainer by becoming a peer educator or a peer mobilizer in the post-school system. The country depends on you. This is the opportunity that I ask you to stand up for this nation and for the sector. Become our ambassadors. But once you join these classes, once you understand and you go to those dialogues, you learn HIV, you learn GBV, then something you have to do is to do your own risk screening. And there are tools that any student who goes into our classes needs to go through risk assessment tools. Know your risk, identify your risk, and very importantly, link to our youth-friendly services, whether it's a campus clinic, whether it's counseling unit, whether psychologist, a social worker, a nurse, a doctor, a community healthcare worker, we need to get you linked to a service, should you be at high risk to any of the diseases. And that's the whole model. Learn, do your own screening, and then act by taking care of yourself right at your own campus, in your vicinity. This slide will show you, we have a manual, we have a curriculum on HIV, we've got a curriculum on COVID and GBV. Go through these curriculums. It might not be for exams, but might be for you and your health. Go through these classes. You can see so many young lives every year go through these classes. It's about longevity of our lives. It's about healthy life. It's about us taking so much of hard work to be where you are and not spoiling it, but rather leading to where the success of yourself is. So join the sessions. A quick note. This is how a mental health risk screening looks for you. So if you've attended a class or attended a lecture or attended a dialogue on mental health, then you answer such questions like, say, look at the question number 2. Are you struggling to cope with daily activities because you are feeling tired and without energy, or unnatural excited with too much energy? Do you avoid people, having difficulty making conversations, and dread social events? We're trying to get you whether you are anxious, you're depressed, or you're at risk to mental health. There's only one answer, yes or no. And should you be in yes, don't be afraid, because there's a counselor, there's a psychologist, and there's a 24-hour helpline waiting for you to help you. Similarly, wanted to show you a risk assessment on domestic and gender-based violence. Look at the question number 10. Have you been hit, punched, kicked, slapped, choked, hurt with a weapon, or otherwise physically hurt by someone in your house or outside of your house? Are you in relationship with a jealous, controlling and possessive partner or family member? And so on. So that we can identify you should you have experienced domestic violence, partner violence, or a sexual violence in the campus. So we get to the bottom of this and we try to fix this. Not only what has happened to you should not happen to the others, but also that you look after your health. Similarly, I won't go in detail on your HIV, TB, STIs, unplanned pregnancies, contraception, all these risks screening tools are part of the classes. So what you learn, you act, and you act on your own body by doing this risk assessment. I encourage all of you to look at these risks and risk assessment toolkits for yourself. My next slide speaks to you about health check. A daily screening health screening toolkit. Whether you are on USSD, you're on WhatsApp, you're on internet or a web form, totally free. You need to screen coronavirus. You need to screen COVID on daily basis. What it does for you, it gives you a passport. It gives you a green passport if you are at low risk. So save the number 0600 11 0000. I repeat, 0600 11 0000. Whether you are on USSD or WhatsApp, at no cost to you, you can screen for COVID. Simple. You start by saying hi, and it will prompt you to check symptoms and testing to this number. You must remember, it will then identify you whether you're at high risk, moderate risk, or low risk. And should you be at low risk, you'll get a green passport, which means you are no danger to yourself and no dangers to your peers or your academics, and you can enter the campuses on daily basis. You have to do health check. Health check is also linked to the National Department of Health and National Institute of Communicable Diseases directly. It also helps us to track and trace you and assist you so that we can bring the test to you, or you can go for testing should the symptoms not last longer, should the symptoms last longer. And we need to ensure that you are not through the COVID pandemic. And we need to ensure that you protect others. The next slide will also show you health check on the web. How you can do it on the web? It's very simple. healthcheck.higherhealth.ac.za. While you are working, you can just quickly in the morning go onto this website, go onto this web form and complete your question, and you'll get a passport there and then, which you can show at your entrance. The aim is we do not do congestions at the gate. We do not stand in close proximity at the gates. We get quick entry. Should you have done your screening at home and you have a passport, you'll be easily entering into your campuses because you're already at low risk. But predominantly you know yourself that today you don't have COVID. And that's the most important point in this whole health screening. So health check right at your fingertips, and you need to do it. Should you don't have a phone, don't worry. There are screening stations at the gate, and you can inform somebody and they will take you to the screening stations to get your screening done on day-to-day basis. Similarly, health check on USSD is you have to call star 134 star 832 star 2 hash and then follow the same prompts, and you'll be given a passport whether you are clear and enter the campuses or not. Very importantly, if I can get to you, 24-hour helpline. Higher Health has a 24-hour toll-free helpline at no cost to you. 2 o'clock in the morning, 3 o'clock. If you're anxious, depressed, you need to speak to somebody. You have suicidal ideation. You're not alone. You have a psychologist, a counselor, a social worker waiting for your call. Call 0800 36 36 36. I repeat again, 0800 36 36 36, or SMS 43336 43336. It is very important. 24 hours. You need help. And sometimes coronavirus can make it much more difficult. It can isolate you. Mental health is real. Gender-based violence is real. It's around you. And any psychosocial health and support, if we can offer you at your doorsteps, this is the one that I would really request that you do. And my last slide. Mobile clinics, campus clinics, they are around you. In those campuses where you do not have campus clinic, there are provisions of mobile clinics coming to you. Where you have a campus clinic, there is a healthcare professional waiting for you. Screening, testing. Once you have identified your risk, you need to link to the service. Whether it's your HIV, TB, STIs, drugs like PrEP, ARVs, condoms, prevention, gender-based violence counseling, support services, reporting, linkage to laboratory testing, dispensary and chronic medication collection, further referrals to our health facilities, or psychosocial. This is all at your doorsteps. At the end, become our ambassadors. Look after yourself. Look after people around you. And ensure that you make South Africa proud and you make your own family proud. Lastly, I congratulate you and welcome you to the post-school education system. Thank you.